So I'm doing IV piggyback. So I'm gonna look at my doctor's order, and I'm looking gentamicin 60 mg IV piggyback every 8 hours. So if I was giving it by a pump, I do 100 milliliters an hour, but I'm doing drops, so I'm gonna do 17 drops in a minute. So that is our dose, that's our time, that's our rate. I mean, not rate, it's gonna be our dose, our time, and what's given, the actual medication. We're gonna make sure the same patient, Sam Wilkins, no allergies. So now we can go strictly by our MAR. So I'm gonna get my book out, and I'm gonna see if it's a safe dose, and it is. We're going to see if it can be diluted. It says further diluted each single dose in 50 to 200 milliliters of IV normal saline or D5. So I know when I go to the med station and I dilute it, I have to have normal saline or D5W. We're gonna check compatibility to see is it compatible with what's hanging in the room. So what's hanging in the room is lactic ringers. So we're gonna check compatibility in the bag. So we find lactic ringers and gentamicin, and it is compatible. We're gonna do rate of administration, 30 to 60 minutes. I work my problem to 60 minutes, so I'm gonna do 60 minutes. And what we need to watch for is urinary output, BUN, creatinine, CBC, and we need to monitor for like allergic reactions like burning of the skin, redness, or anything at the site because it's an antibiotic. So now I'm ready to go to my nursing station and get my supplies. So I've done this before, so my supplies are gonna be open. So I got my tubing and my bag, my label, and alcohol pads. So my bag, I'm checking to make sure it is not cloudy, it's nothing floating around. And then we're gonna look at the expiration date, and that's fine. And then it says it can be diluted in 50 to 200 milliliters of normal saline or D5W. So this is normal saline and it's 100 milliliters, so this is fine. I've done this before, so I already labeled it, but I label it. I do the name, I'm doing drops, so I put how many drops, the date, my name, and when did I start this. So then while I'm in the nursing station, I'm going to prime my tubing. And you don't need gloves for this. And make sure everything is clamped off because I don't want to waste it. Okay. So there it goes. Okay, I wasted a little bit, but I already had primed it before, like I stated. And now we're ready to go to the patient's room. Let me get my hood. Okay. So I am in the patient's room. I'm going to introduce myself. So hello, my name is Samantha Wilkins, and I'm a student nurse at MCC, and I'm here to do an IV piggyback. So can you please tell me your name and date of birth? Now look at the armband. Now look at the armband, and it matches up. That's fine. Matches up with MAR. That's good. Then I'm going to ask the patient, do they have any allergies? And they're going to say no. Okay, that's good. So then I'm going to explain to them what I'm doing and what I'm giving. So I am here to give you an IV piggyback. It's gentamicin, and it's an antibiotic. And with this, you need to tell me at the site, do you feel any burning or itching or redness when it starts infusing? So Now I can get ready. So I'm gonna perform hand hygiene. And I'm going to lower my primary bag. Well, before I do this, I'm going to make sure the line is open and patent. So I would drop this and make sure I get good flashback and to make sure it's open and patent. And I'm going to perform hand hygiene once again. Okay, so now I'm going to lower my primary bag. And I'm going to put my secondary bag higher than my primary. Get an alcohol pad. And I'm going to clean the port closest to the bag. So we're gonna clean this for like 30 seconds. And if this was into an INT line, I would have on gloves. Okay. I am going to connect my secondary line to this. Okay. So now I'm going to open my secondary line wide open, and I'm going to regulate it with my primary line, but I'm looking at my secondary drops. And this is the arm that it doesn't work, so we're gonna dangle it over the trash can to get my drops, but that would happen in a clinical setting. So we're doing 17 drops in a minute. Make sure it drops. There we go. So I'm going to start there. Let me see. Okay, so we're going to start at the 9. Go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17. So we're regulated. We're gonna wait 1 minute again. Okay. So now I'm gonna let that infuse. That's gonna infuse. I did it for 60 minutes. So after my 60 minutes, I'm gonna come observe my patient, make sure it's tolerated well. Of course, this would be in their arm. I am going to take down my secondary. And with the start of that, I will raise my primary back. And I will set this back to the rate that it was dropping. And then I will go document what I did.